So why is there a need for humanitarian reform?
It's not just UNOCHA that thinks there's a need for humanitarian reform. A lot of organizations recognize that there has been a lot wrong with the system of international response to humanitarian emergencies. We saw in Darfur, in Sudan, in 2004, that there were a number of sectors that were badly covered in the initial stages of the response. For example, water and sanitation. It wasn't clear at the beginning who would be in charge of that sector, who was involved, what resources were available for that sector. In some of the other sectors, camp management for the internally displaced there, no agencies wanted to take responsibility for that in the early days. Protection, humanitarian protection, none of the agencies were willing to come forward, put staff on the ground and take the lead in developing strategies and organizing humanitarian protection in Darfur. Emergency shelter was another area. A few organizations said they were willing to chip in, but chipping in is not good enough when you've got hundreds of thousands or millions of lives at stake. And it was clear that not just in the case of Darfur, but in many different humanitarian emergencies, there were major gaps in the system of humanitarian response. You've got clear leads in certain sectors. For example, you've got the United Nations World Food Programme for food. You've got the United Nations Food and Agriculture Organization. You've got UNICEF for children. But you've got the United Nations High Commissioner for Refugees. But for many other sectors, it wasn't clear who was going to take the lead. There's no United Nations High Commissioner for Internally Displaced Persons. There's no World Water and Sanitation Programme. So we had to do something about the system that had too many holes in it.
Okay, so what did you do?
Well, that's when we decided to commission an independent evaluation of humanitarian response capacity at the global level, find out what capacity really is out there, and take it from there. So we carried out this independent evaluation, and this evaluation that looked not just at Darfur, but it looked at the response to the tsunami. It was looking at emergency operations in countries like Liberia and Somalia and the Congo and many other countries. This evaluation showed that yes, it was true that there were big gaps in certain sectors, and it proposed new ways of addressing some of those gaps. It also showed us that the whole system of partnership between UN organizations and non-UN humanitarian actors, the NGOs, the Red Cross, Red Crescent movement, the International Organization for Migration, all these different actors, the system wasn't working very well. Individual organizations were often doing a great job, but overall partnership between these organizations was not good. The UN had become very good at using some of these NGOs as subcontractors or as implementing partners, as we sometimes call them. The UN was not always so good at seeing these organizations as strategic partners. And yet that is what they should be today, because in many of today's emergencies, these NGOs do the bulk of the work. It's interesting that in Darfur, in the early days of the response there were more staff from Médecins Sans Frontières than the entire United Nations system put together. More MSF staff in Darfur than all the United Nations agencies put together. And yet, at that time, the central decision-making body for the humanitarian operation was the UN country team, meeting in isolation. So the bulk of the work being done by the NGOs, the bulk of the planning, the advocacy, the leadership at the government level was being done by the UN. Something was wrong. We needed to find a better way to work together with all our different partners. So this evaluation of humanitarian response capacity put forward a number of different proposals, ways of improving humanitarian response, and that's what eventually led to what we now call the humanitarian reform process.
So is this just about the UN putting its own house in order?
No, this is not just about the UN. In fact, this reform is anchored in the Interagency Standing Committee. That is a body that we have at the global level which brings together UN organizations, NGOs, the Red Cross, Red Crescent Movement, IOM, the World Bank, different actors. It brings them all together in one central policy-making, decision-making body. It's called the Interagency Standing Committee. And this reform is an IASC reform. It's not a UN reform program. There is a separate process of UN reform, which people know a lot about. It's often on the news. This is broader than a UN reform. It's about the way the whole, it's about the whole international system of response to humanitarian emergencies.
What will be the differences after the reform is implemented?
Okay, so the reform has three main components. The first component is that of strengthening leadership in humanitarian emergencies. It's strengthening the humanitarian coordination system. In many countries, in 25 countries around the world at this moment, we have UN humanitarian coordinators. In fact, they're not just UN. These are people who are employed by the UN, but they represent the broader international humanitarian community. And these humanitarian coordinators are responsible for overseeing and leading humanitarian operations in the 25 countries that they're posted in. We also have UN resident coordinators in many other countries, and many of these are disaster-prone countries. When we have new emergencies in these countries, a new earthquake, a hurricane, flooding, or even a new outbreak of conflict or violence in a particular country, where we have a new emergency, the resident coordinator is responsible for coordinating, for overseeing the coordination of the international response to that emergency.
Okay.
And so that's one component of the reform, is strengthening the leadership. Another component of the reform is improving the whole system of humanitarian financing. There's different ways of doing this, and in many ways we're only just starting out on this process. But one new mechanism that is often talked about is the Central Emergency Response Fund, or it goes by its acronym SURF. The SURF is a fund that we now have at the global level. It's managed by UNOCHA, and the idea is that this fund will have a total of $500 million in it, and this money can be used for two different purposes. First, for responding to new emergencies. So we now have a pot of money that's available to be used in the first hours or days of an emergency. In the past, it often took us a long time to mobilize the necessary resources in new emergencies. Now we have a pot of money which can be called upon and used right at the beginning of a new emergency. That money can also be used to fund operations in some of the more neglected emergencies. In the past, we've often complained that donors have put a lot of attention to some of the big emergencies where CNN, the BBC are all following these emergencies. Others have been much more neglected. So this money can be used both for the neglected emergencies and to kickstart operations in new emergencies. That's the second component of the reform. And then the third component of the reform is about improving response at the sectoral level. And that's what has come to be known as the cluster approach.
Okay, you talked there about sector and cluster. Are they the same thing?
Yes, that's a question that is often asked. Is a sector the same as a cluster? When we talk about the cluster approach, we're really talking about a partnership approach. We're trying to ensure that in each of the sectors we respond not simply on the basis of individual agencies, but having more of a task force approach or a partnership approach, a group approach, what we call the cluster approach, so that for each sector you have a group of organizations that works together to address needs in that particular area. That's what the cluster approach is all about. And it's about improving the capacity of these agencies to respond adequately in each of these sectors. I mentioned earlier that in the past, sectors such as water and sanitation, there was no clear lead agency at the global level, and often at the country level there was no clear lead agency. We're trying to ensure now that with newly designated global leads in all areas, those agencies are responding for building up the global capacities, for doing the necessary standard setting, for ensuring that you have clear policies for all these sectors, that you have adequate stockpiles and rosters of staff who can be deployed in new emergencies. At the country level, we're also trying to ensure that by having designated agencies who are responsible for leading the response in each of these sectors in support of the government, that we'll have a much more predictable and efficient system of humanitarian response.
And what will be the benefits of this cluster approach?
Ultimately, we want to ensure a much more strategic response in emergencies. In the past, the response was often based on who gets there first. It was often simply a scramble for territory. And we saw a lot of competition, rivalry amongst agencies, and we also saw a lot of bickering and duplication. And frankly, in the past, what we've often seen is very amateurish and ad hoc responses to emergencies. We want to ensure that in the future we will have a much more predictable system, better accountability. You know who to turn to in each sector. You know who to call on when there's a gap that is not being addressed. The emergency relief coordinator at the global level knows who to call on if there are particular problems in a particular sector. Governments know who to turn to, who's going to be their main counterpart in a particular sector. In the past, it was often the case that hundreds of international organizations would arrive in a particular country, loads of different acronyms, you didn't know who was doing what, and even we ourselves don't know all these different organizations and these confusing acronyms. It was very difficult for governments to understand who these different organizations are. We're trying to make the lives of donors, of governments, of the people that we're there to help much easier by having a better structured humanitarian response.
Now, some people say this is just about the UN trying to get everyone else to dance to its tune. Is that how you see it?
This is not about the UN sitting on top. This is about us working together with partners in a much more strategic way and working together as equal partners, recognizing the different strengths and weaknesses, the comparative advantages of the different organizations. The UN is often better placed to do the overall leadership, the interface with government, coordination, advocacy, monitoring, these kinds of roles, while our NGO partners, or the Red Cross, Red Crescent movement, IOM, some of these other actors are often better placed to be providing the assistance itself, to be doing the direct implementation. There's a lot of capacity out there now, and often we find that NGOs are much quicker, they're often more cost-effective, they're often much better at getting out to the remote areas that are inaccessible. Often the UN has all kinds of security restrictions that are imposed on us by the system, while NGOs are able to act much more quickly and efficiently. So we need to look at how we can better complement each other. In many cases, the UN, under this new system of the cluster approach, the UN in many of these sectors will take the lead, will be the coordinator for these different sectors, but will work through a strong system of partnership. And as I say, working together as strategic partners, as equal partners, not somehow going back to what we had in the past, where we simply often used NGOs as our subcontractors.
And where do governments fit into all of this?
All of this is about improving the way that we work with governments, improving the way that we work with affected populations, improving the way we work with national civil society, with local NGOs, with international NGOs. It's about improving the whole structure. There's now a lot of actors out there. This is not a question of a humanitarian emergency where you've got 10 or 12 different agencies involved. Often we're talking about hundreds of them. And our role is always to remind governments of their own responsibilities towards their own people, to assist them in providing the necessary assistance where assistance is needed. In many cases they are not asking for our assistance, or we don't have access in many situations. But we have to distinguish between some of the conflict situations where we often work with governments, we're working with some of the non-government authorities in conflict situations, and distinguish between that and some of the natural disasters, or disasters in general, where you might have a government which is in a very strong position to lead and coordinate the overall response, and they're asking us really to fit into their system and support them, and they're in a strong position to lead the response. For example, in the Pakistan emergency response to the earthquake there a couple of years ago, the Pakistani government had a lot of resources, and its own military was very much engaged and proactively leading the humanitarian response, and we were there to assist them. In some other situations, if it's whether we're talking about Darfur or Eastern Congo or Liberia in the past, or Somalia, countries such as these, we have a different kinds of relationship with governments. Often they have less capacity, often they are not willing to lead the response. In some cases they are the obstacle. They are trying to thwart the humanitarian operation, and we have to look at ways to hold them accountable, to remind them of their responsibilities, and to complement them and assist them in whatever way possible. But all of this is about finding a better way to work with governments and with all our different partners.
Is there a risk that this could just end up with bypassing governments completely?
Governments have the primary responsibility for addressing the humanitarian needs of civilians affected by disasters on their own territory. We are not trying to substitute for governments. Governments have that responsibility, and where governments are asking for assistance, we need to support them in providing that assistance. The cluster approach is about us ensuring that we are better structured as an international humanitarian community so that we can provide better support to governments and to the other partners with whom we work.
Is there anywhere that the cluster approach is already being used at the moment?
We started using the cluster approach in the Congo, in Uganda, Liberia and Somalia. These were the first countries where we rolled out the new cluster approach. Since then, we've also used the cluster approach in a number of new emergencies. For example, in the response to the earthquake in Pakistan, in Yogyakarta in Indonesia, in Philippines in response to a typhoon there. We've also used it in Mozambique, in Madagascar, and recently in the Dominican Republic. I may have forgotten one or two, but we've used it in a number of new emergencies which have been caused by cyclones or earthquakes, other disasters.
And has it worked?
Yes. We recently had an independent evaluation of the first 2 years of the experience of using the cluster approach, and this evaluation has shown that there are a number of areas that we still need to provide more guidance on. where we need to further develop the policy, where we need to make some improvements. But overall, this evaluation has shown that in all of the countries that were studied, the general feeling is that the cluster approach does add value, that the responses have been better in those countries, that there's been better attention to the gap areas that were there in the past, that there's been better partnership between the UN and non-UN humanitarian actors. So overall, the verdict is that in the countries where we've used the cluster approach so far, we're seeing a lot of improvement. We still have some detractors, but it's interesting that in this evaluation, of the 400 people who were interviewed in a survey, because many others were interviewed as well, hundreds more were interviewed in a more detailed way, but in a survey that was done, only 8% of those surveyed said that they did not think the cluster approach was the right way to go. Others felt that even if there were problems, they still felt that the cluster approach was better than what we had before.
Are you going to try to address some of those issues?
We have to address those issues. There are still a number of problems that we need to address. For example, the whole question of activation of the cluster approach. There's confusion about what does activation mean.
What does activation mean?
I think it's a flawed concept. In fact, at the global level, we have already activated the cluster approach. We have it at the global level. What we want to see now is that in all new emergencies, this new capacity will be used where it's needed in order to avoid unnecessary gaps, in order to ensure proper accountability and better response. At the country level, what we need to do is to ensure that in all the existing emergencies and in all emergencies in the future, that we formalize the arrangements that we have for response. We need to be clear about what are the main sectors for this particular operation and who is the lead for each of these sections. Sometimes that's called activation. I think a better term is formalization. We need to have some process for being clear about who is the lead in each of these different sectors. So we now have some new operational guidance on designating sector or cluster leads in major new emergencies. But the operational guidance is not on activating the cluster approach, it's on how to designate these leads. Because we want to get to the point where this simply becomes the way we do business in all emergencies. We should not have to activate it or deactivate it. It should become simply the way we work.
Is the cluster approach now completely activated at the global level?
Yes. For a number of sectors, we now have clearly designated new lead agencies. For example, for water and sanitation, UNICEF is now the global lead. For emergency shelter in natural disasters, it's the Federation of Red Cross and Red Crescent Societies. For emergency shelter in conflict situations, it's the UN Refugee Agency, UNHCR. So we have these new arrangements in a number of different sectors at the global level. There may still be some changes in the future, so I don't want to say that it's fixed for the next 100 years, but yes, we now have a new system which should not require so much further adjustment at the global level.
So we have these global cluster leaders. What are their responsibilities?
Their responsibilities are in three main areas. First of all, on the standard setting policy side, they're responsible for ensuring that all their partners are familiar with the international standards and agreed convention or international law relating to that particular sector. If there are any new policies relating to that sector, they're responsible for endorsing or developing these policies and for disseminating them and ensuring that their partners are aware of these. The second area of responsibility is that of building up stockpiles or at least having databases of what is available at the global or regional level, what can be called on in new emergencies. So stockpiles such as tents or blankets or food or other emergency supplies that may be needed, and also for developing the necessary rosters of staff who can be deployed in emergencies. And the third category is that of providing operational support in emergencies. This may involve helping with resource mobilization, advocacy, emergency preparedness, other kinds of operational support in emergencies.
Is there a risk that this could just become an exercise in rules and policies and bits of paper rather than any practical change?
There's always a risk that we get too bureaucratic in this process, and we have to try to not fall into that trap. The cluster approach was criticized early on for involving far too many meetings and too much paperwork. The cluster approach itself does not call for meetings. It calls for appropriate coordination, and it's the responsibility of cluster leads and of cluster partners to ensure that appropriate coordination arrangements are put in place. That does not mean having one meeting every week for every single sector in every town in every country. It's about putting in place the appropriate mechanisms. And likewise with paperwork. In the UN we're good at producing paper. We produce far too much paper. It's not about producing lots of policies. It's about producing useful policies, concrete policies, practical policies, the right ones to help us work efficiently, effectively in emergencies.
So you said that this is now activated at the global level, but what's happening at the country level?
At the country level, we would like to see a lot of flexibility in the way the response is organized. It depends on who has capacity on the ground in each particular country. Sometimes you've got organizations that have been there for many years. They know the local situation very well, and they're well placed to lead the response in that particular country. So it's not always essential that you replicate the arrangements that you have at the global level at the country level.
So who will decide who's going to be the country cluster head?
The humanitarian country team, that's the different humanitarian actors, will work out themselves who they believe are best placed to lead each of the sectors. They'll work out which sectors are appropriate for that particular response, and they will then just ensure that there are no objections to that from the global cluster leads, because we have to ensure that in all situations the global cluster leads are satisfied with the arrangements that are in place at the country level, so that they can provide the necessary support and so that they can basically continue supporting those arrangements as appropriate at the country level.
What does this being a provider of last resort actually mean on the ground?
Practically, on the ground, provider of last resort means that where funds are available and there's no access or security restrictions that are preventing you from doing a particular project, then if everyone agrees that there's a priority need which is not being met, the cluster lead is responsible for stepping up to the plate and addressing that need. In the past, we had situations where donors were willing to fund particular activities, but agencies still said, sorry, we have other priorities, it's not our mandate, we're not going to do it. Now we have a system where we know who is the cluster lead and we know that they are accountable for acting as the provider of last resort. So if there's an outbreak of cholera in a particular town or district, it's no good for an agency to simply say, sorry, we're too busy in all these other districts, or we've got other priorities in other sectors. No, the agency that is responsible for being the lead in that particular sector, in this case it would be the health sector, in that country, they are responsible for ensuring an appropriate response in that particular area. And if that means putting their own people on the ground and sending in their own medical supplies, then they need to do that. Of course, it's always subject to the availability of funding access and security. No one is asking the cluster leads to do the impossible.
And how can you ensure that they live up to their obligations?
Well, this is all about accountability. For each of these cluster leads now at the country level, we have a clear terms of reference. It spells out what their responsibilities are. And one of their responsibilities is to act as the provider of last resort. They are accountable to the humanitarian coordinator in that particular country. And if the humanitarian coordinator feels that there's a problem, first of all, they can address that problem to the agency concerned at the country level. If that doesn't work, if you don't get the results that you need, you can address the global cluster lead for that particular sector. And if that still doesn't work, you can talk to the emergency relief coordinator. But we have a better system now to enable that kind of dialogue, because we will designate more clearly the leads in each countries. They have clear terms of reference, and you know who is accountable and who they are accountable to.
And overall, how effective has this new approach been?
We've seen a lot more attention to some of the gap areas. In the Congo, only 3 years ago, water and sanitation was identified as one of the big gap areas. That year, all the different agencies together appealed for only $1 million out of $680 million. They appealed for $1 million for water and sanitation. 2 years later, they were appealing for more than $100 million for that particular sector, out of a total which is not very different from the total that they had previously. So what we're seeing is a much more balanced response in the Congo. We've seen the same in northern Uganda. In the past, we had a humanitarian operation there, but it was stronger when it came to dealing with health, nutrition, those kind of issues. It was very weak when it came to humanitarian protection or camp coordination and camp management. Since we've had the cluster approach in Uganda, we've seen agencies devoting many more resources to address those gap areas that had been identified as clear gap areas in the past. So we saw UNHCR building up its capacity and taking on far greater responsibilities in Uganda than it had done in the past. These are responsibilities for camp coordination and protection for the internally displaced. Likewise in Congo, we saw UNICEF taking on the lead role for water and sanitation. And I could give you many other similar examples of where we've seen much better attention to gap areas.
So after your reforms are all ready, do you think the response will be perfect in the future?
It's not going to be perfect. We're still going to have problems in the future. We're never going to get the funding that we require for all humanitarian operations in every country. It may be difficult to build up the kinds of capacities that we would like to see, but at least we have a better structure in place now, and we know who to turn to if there's a problem. In the past, in a sector such as food, we had the World Food Programme. That didn't mean that every hungry mouth in this world was fed. It did mean that where there's a problem, you could turn to the head of the World Food Programme and say, why is it that more is not being done in this country? And similarly now for all sectors, we know who to turn to for each of the different sectors.
Is this just a fashion, a fad? Is it going to be the case that in perhaps 2 years' time we'll have moved on to something else and clusters will be forgotten?
We may still have to make further changes later on. We know that there are some issues that we've not fully addressed. Integrated missions, working with the military in some of these big peacekeeping operations, we still need to do further thinking about how we work in those kinds of situations. Relief and development, the interface between the two. How can we avoid some of the gaps that we've seen in the past in that area? I think we're making progress now through the early recovery cluster, which is helping to give much more focus to that area. But again, these kinds of things are going to need a lot more attention in the future. But overall, with this reform process, I think there's no turning back. No one wants to go back to what we had in the past. In the past, responses were far too unpredictable, ad hoc, unreliable, and we now have a structure which everyone agrees allows us to respond in a much more predictable and effective way.
How quickly can all of this be rolled out?
There's a lot of controversy about how quickly or how slowly to go in introducing this reform. On the one hand, we want to make sure that we have the clear guidance in all areas and that staff are properly familiar with the cluster approach and trained before we introduce it everywhere. On the other hand, we want to get on with this. We're doing this because there's been a problem. We want to ensure that humanitarian responses are more effective, and we cannot wait for the next 10 years to start doing this. So we're trying to do it quickly. We hope that very soon we will have the majority of countries with humanitarian coordinators using the cluster approach, and soon we hope that all countries with humanitarian coordinators will be using the cluster approach. We have been appealing for funds for capacity building of the global clusters. We had an appeal in 2006 and another appeal in 2007. We're not going to have any more specific appeals for the global capacity building effort, but that doesn't mean that the global capacity building will not continue. It simply means that the global cluster leads will have to build those activities into their ongoing programs. They'll need to appeal for funds through their normal fundraising mechanism. So we're talking now about mainstreaming the cluster approach into the work of all the different agencies.
And do you think that the cluster approach has been a success so far?
I think it's a huge success. It's much better than what we had before. We should never lose sight of what it looked like only a few years ago. Humanitarian response now is big business. It's $13 billion annually that we spend on humanitarian assistance. And it's no longer acceptable that we simply arrive in each new emergency and have a scramble for territory, and we divvy up the pie. We decide who's doing what simply on the basis of who gets there first, who has the loudest voice, who is willing to stake their own territory and put up their flag fastest. That's not the way we should organize response. It needs to be based on real expertise in that particular area and proper accountability. In the past, we've looked at humanitarian response as some kind of charity work. No one should hold us accountable. We're somehow beyond scrutiny because we're good people, helping people because we want to be kind. We're doing this with good motives and risking our lives doing things we don't need to do. We can no longer continue to justify inefficient responses on the basis of good intentions. We need to ensure that this work that we do, that we all believe in, that we know needs to be done, is done in an efficient way, and that there's proper systems of accountability, that we build up the necessary capacities and have proper expertise in the different sectors, and we have to professionalize the work that we do. This whole reform program is about improving humanitarian response. It's about helping people and doing it more effectively. It's not about coordination for coordination's sake. It's not about ourselves. It's not about these so-called global cluster leads or the country cluster leads. It's about working better together to help people to prevent unnecessary loss of life and to be effective in the way we do our work.